So you can see my screen, right? Okay. If I'm disconnected again, please text me, text in the group. So starting from here, what is the purpose of MRCS Osce exam? This exam is actually to get your GMC registration. That is the first point. Why this is important? Because if you have passed MRCS Part A but not MRCS Part B, you cannot get GMC registration with only MRCS Part A. Someone was asking in the group. So MRCS Part B is essential to pass the to get your GMC registration. Second, you cannot enter into UK or Irish training system without your ST3, without your MRCS Part B. So you cannot enter. One thing which I want to ascertain, and you must pass it to your juniors, please, and don't be greedy in this part, particularly to passing on this information to your juniors, please, is that MRCS route is much less costly. Number one. Number two, less time taking. Number three, adding more qualification to your CV as compared to your plab route. How? Both parts, MRC Part A and Part B, you can do in 1 year. While in the plab route, you know that getting your seats in plab 1 and then plab 2, it's extremely difficult nowadays. Although it's difficult for MRCS as well, but it's not that difficult. Second, nowadays different colleges are conducting their exams in Pakistan, so it is becoming more and more easy to get the seat. Second thing, if you compare the cost with PLAB and the MRCS, so as MRCS, both parts can be done in Pakistan, and if you are in different country, both parts can be done there. So while for UK you have to get visa, you have to go to there, stay there for 1 month, get your academy fee for plab 2 and all these things, you know very well. So that is almost 50% less cost, number two. And number three, that is even more useful as compared to that, MRCS exam is, if you pass this exam, it means you have post graduation qualification, while PLAB exam is only your licensing exam. So please, whenever you're guiding your juniors, and you must guide them properly, that which exam they should go for. uh, Otherwise they will lose their money as well as their time, and they will not be getting their job. Nowadays in UK and Ireland, they always prefer those candidates who have passed who have some post graduation qualification. So I would say that this pathway is much easier, a little bit difficult to pass, no doubt, because it is not basic exam, but it has more, you get more chances to secure your job as compared to simple plab, and that is without any doubt. Okay. Now coming that how this exam will be conducted. So this exam will be you will be having total of 17 stations. So now please take your pencils and paper and write down these things, because I will be seeing a lot of these questions again and again. So please write down these things. Number one, there will be 17 stations in total, 8, but these will be in 2 parts. One will be the knowledge part, other will be the skills part. Both parts you have to pass separately. If you are fail in knowledge part, you are fail in total. If you are fail in skills part, you are fail in total. You have to pass both parts separately. Third thing, in the knowledge part, there are 8 stations. In the skills part, there are 9 stations. So 8 stations in the knowledge part, 9 stations in the skills part. Each station will be of 20 marks. Each station will be of 20 marks. It means 160 marks in the knowledge part and 180 marks in the skills part. Okay, so up till now it is clear. Okay, now coming separately to the knowledge part and the skills part. In the knowledge part, there will be 3 different categories again. That will be anatomy, pathology, and critical care. Anatomy, pathology, and critical care. So these are 3 different parts. So you will be having total 8 stations, 3 from anatomy, 2 from pathology, and 3 from critical care. So 3, 2, and 3, total 8. So every station you have 10 minutes in total. 10 minutes in total. 1 minute outside the room, outside the cube to read the question. 9 minutes inside to answer the questions. This is for knowledge part. I'm not talking about the skills part. Okay. So this is the knowledge part. So one minute outside and 9 minutes inside. So this is the and this is all about knowledge part. So what you have to do for the anatomy and what you have to do for the pathology and critical skills. Anatomy nowadays is about 2 things. Number 1 is spotting, and number 2 is surface marking, and then questions related to those. So how the question will come in the exam? They will paste a question outside the cube. For example, there is a patient, 20 years old, young patient. He was going on the motorbike cycle. He has a road traffic accident, and now there is injury to the leg, and inside there are models from the leg, and you have to answer the questions. So now you know that I have to answer about the lower limb. Similarly, about the upper limb, head and neck, and all these things. So they will give a scenario, and then you have the question. The question will not be like this question. The question will not be clinical. That will be all about the anatomy. What is this structure? What is its function? What is, if injured, what will happen if injured? So they will not ask you in the anatomy portion about the management of the patient. The question will be only and only related to the knowledge. Okay, they will not ask about the management in the anatomy part. But they will ask you about the injuries, nerve injuries, vascular injuries, muscle, tendon, all these things, their insertion, their origin, and their function. So particular muscles, all these things. So remember that whenever you're preparing, you would be prepared. And when, very important thing, the anatomy part is all related to your spotting. So this is not about only knowing that this muscle, no. You should know on the model that, and you should know not only one model, different models, that what is this structure and what is its function. Okay, so this is about anatomy. Second is pathology. In pathology, they will give you a scenario similar to anatomy. So they will give you a scenario, and from that scenario, they will ask you about pathological findings. So pathology, I would say that it is all about, I would say that, rata. Okay. So you have to know the definition, exact definition by words. Okay. Exact definition by word. So you should know about the definition, about the mechanism, and then they ask you about the treatment at as well at the end. So you take it. One thing, guys, very important, please write down in the anatomy as well as in all the knowledge part. You will be given almost 18 to 20 questions. In the anatomy, 25 to 30 questions. Other parts and will be 18 to 20 questions. Only 9 minutes, 18 to 20 questions. What does that mean? It means you will be having only 20 seconds to answer a question. You understand what I mean? Only 20 seconds to answer a question. So if you are like doubtful for something, skip that. Skip that question, go on to next. Okay, and then come back. Okay, they are very I would say generous in this thing, that you can easily skip a question and then you can come back. Okay, so they can guide you after that. So and all these questions must be on your fingertips in the anatomy, pathology, and critical care. Similarly, in the critical care, for example, they will give you scenario about burn, about head injury, about the liver injury, HCV, whatever. So multiple topics they have. They will give you a scenario, and then you have to attempt the questions. So this is one thing. Now the next question is what you have to study for it. This is the most important question. What you have to study for this. So all of you are given the material already in the group. Okay, it are already in the shared in the group. If you are not having this material, you can join the Telenor group, Telenor, sorry, not Telenor, Telegram page channel in the link description, in the link given in the description of the group. So there is a link for the Telegram channel. You can join that. All material is there. Now, please write down what you have to study for and don't go beyond that. If you go beyond that, until go, if you go beyond that before doing all these things, then you will be in trouble. So first, master these books, and then if you have some time, if you have some you feel that I have done all these things very well, then you can move on to the next. So for the knowledge part, number one is um, Sala notes. These are updated, and these are already uploaded. Number one, Sala notes. Number two is McMahon Atlas. McMahon Atlas. So this is more than enough. More than enough. But again, how to read this? In the Sala notes, they have written the questions. For example, what is the function of this muscle? In the exam, they will not ask you that what is the function of this muscle. They will ask you what is this structure, and for example, that muscle is bicep brachii. For example, I'm just giving. They ask you what is this muscle. Okay, you will find out this is the muscle. Which muscle is this? Okay, this is bicep brachii. And then they will ask you, okay, what is its nerve supply? What is its origin and insertion, and what is its function, and all these things. So they will not ask you directly question what is the function of bicep brachii. That is first year medical student question. Okay, so they will ask you this question in this way. So the question, the mode of question is different. And there is one other book known as Sing Notes. Sing Notes, SINGH, Sing Notes. These are already uploaded in the group. So whenever you are done with the Sala notes, go with that. I am also this time, because previously most of the candidates asked me to conduct only online sessions for the anatomy part. I have conducted multiple sessions for the anatomy, pathology, and I have made my own files for these. But this time I feel personally that I need to make a comprehensive lecture on every topic and then upload it. So now this is the next movement I am going to do, is to make the comprehensive lecture for all these topics of anatomy, pathology, and critical care, and then I will upload it. Some of these are already uploaded on the YouTube channel. You can go through that, and others I will upload, but it will take time. Obviously, if I record 1 to 2 lectures every week, it will take time. So, but I am doing though. No, this thing is coming in starting from today. So this is how you have to go through your knowledge part. So I am again summarizing for the knowledge part. What you have to do, Sala notes and McMinn Atlas. Okay, go through that, and then if you feel that, then you, after that you can go with Sing notes. Sing notes, I would say these are almost same as Sala notes, but their way of question is different. Way of questions are different as compared to the Sala notes. So go through Sing notes after Sala notes. Now coming towards the uh, skills part. Skills part, again, you have 9 questions, 4 different parts, as 3 parts in the knowledge, 4 parts in the um, skills part. So in the skills part, just let me show you. Okay, so in the skills part, you have number 1 is history, number 2 is communication skills, number 3 examination, and number 4 is technical skills. So there are 4 different parts: history, examination, communication skills, and technical skills, surgical skills. So for this part, what you have to study, number 1 is Bazir notes for the history, communication skills, and examination. And there is another book for the surgical skills known as Andrew Miller. Andrew Miller. So Bazir notes, Bazir notes for history examination and history examination and communication skills. For the surgical skills, it is Andrew Miller. It is uploaded already in the on the Telegram. Okay, so these 2 books, and very important here, I will say, and I would appreciate my team, Dr. Norez and Mr. Norez and Mr. Waji and Mr. Shazeb. I would appreciate, they are conducting hands-on sessions across the Pakistan, every city, by their hard work, extremely hard work they are. I would say more hard work than me. I started this program without any cost in 2023, and then I moved there to Ireland in 2024, and they are continuing this program. So they are moving to Islamabad, Lahore, Karachi, everywhere. So they are conducting it extremely cost effective. Okay, I would say that must go through this, that 3 days course, that is very, very handy and important as well. Okay, so attend that course. But again, guys, here I am really angry with all of you, except few guys from Egypt, from Saudi Arabia, and Zimbabwe, and Nepal, and India. They are the guys who go through my videos before hands-on sessions. They are the guys. But Pakistanis, I'm really very sorry. I request them even that please go through these videos before your hands-on sessions, because if we have to deliver same lectures to you in the hands-on sessions, it's your time and money that will be wasted, not ours. So please, whenever you are given the videos and all the material about 1 month ago, we asked them to get it 1 month ago. So go through all that, try to practice, and whenever you are coming there, try to get hands-on, more hands-on as compared to the lectures. So this is your fault, not our fault. So please. So now again towards the skills part. Coming again towards the skills part. 4 parts: history, examination, surgical skills, and history, examination, communication, and surgical skills. In the history, you will be given 1 minute to read the question outside the cube, 6 minutes inside the cube to take the history, and then 3 minutes to summarize your case and answer the questions. Please now listen carefully. Instead of commenting here and asking the questions, listen carefully. At the end, you can ask the questions. So 1 minute is very important. First 1 minute is very, very important. Okay. I would again ask, because please don't ask the question now. Listen carefully, because you will be asking this question again to me. Number 1, that 1 minute in the skills part, all the skills part, is extremely important before entering the cube. Why? For example, I give you a scenario. There is a patient who came to you with who presented to you with pain abdomen and bleeding per rectum, and this patient is brought to you by ambulance. So this is one case scenario. For that, you have to take the history. Now you read the question. Okay, this is the patient with pain abdomen, bleeding per rectum. Okay, this is bleeding per rectum, so it is a case of PR bleed. So it will be straightway case of colorectal carcinoma. You ignored that the patient is brought by the ambulance. You ignored that the patient was having severe abdominal pain and then bleeding per rectum. So this is not the case of severe rectum. This is the case of ulcerative colitis or Crohn's disease. No, you are taking the history wrong way, and you are presenting the case for the severe rectum. Why? Because in the first 1 minute you did not focus on the question. So this first 1 minute is important in every history, examination, surgical skills, and counseling station. If you are not focusing in that 1 minute, you are ruining, you are destroying your whole station. Believe me, I still remember a candidate who was given a scenario of abdominal examination, went inside, did the abdominal examination, and came back. And when he focused again, it was not abdominal examination, it was C-crisp. So you have to focus on that 1 minute. That is the key. If you're not focusing on that 1 minute, you are absolutely destroying your station. Okay. So that 1 minute. Next 6 minutes, you have to take the history, and that should be according to the protocols. And then 3 minutes, you have to, in those 3 minutes, you have 30 seconds to present your case, and 2.5 minutes to answer the questions asked by the examiner. In this part, I would say that in the history and communication skills, you should never lose a single mark, a single number. Why? You can score easily all the 20 marks in the history station as well as in the communication skills. So you can easily. Second is examination. In the examination, same scenario. 1 minute outside the scenario, outside the cube for to read the scenario. 6 minutes inside the cube to perform the examination, and then 3 minutes. In these 6 minutes, you have to perform the relevant exam. Now, again, it is important. Asking me again a foot drop examination, example, ankle examination, a diabetic foot examination, which part should be done first, which part should be. So if you are not focusing on the scenario, if the patient is, examiner saying to you, the patient is having, is diabetic and he is having no numbness and foot drop and all these things, and please examine the patient, it means you have to do sensory and motor examination first, and the other things will come later on. Sensory will come first. If the patient, he is saying that the patient is having ankle injury and all these things, so it means that part related to the ankle joint, that will come first. So now you have to focus. That is known as professionalism. That is known as professionalism. I will come to that point later on. Let me focus on this thing at the moment. So 1 minute is extremely important, every part. Similarly, in the communication skills, they have two different stations. Again, in the communication skills, one is communication with the patient. The other one is call to the consultant. So in the communication, I have my lecture already uploaded on the YouTube. I will share the link. Please listen to that carefully, note down the points, and then perform according to that. But summarizing it, in the communication skills, for one station, you will be given separated 10 minutes, separately 10. In the first 10 minutes, 1 minute outside the cube to read the question, 9 minutes inside to read the file, whole file of the patient. You have to read whole file of the patient in the next 9 minutes. And then in the next room, you will be given again 1 minute to read the same scenario. And then the 9 minutes to communicate either with the consultant or with the patient, whatever the scenario is. So these will be two stations. One with the call to the consultant to summarize the case, other case to communicate with the counseling of the patient. So this is about the communication skills. Then there are surgical skills. Surgical skills, one of the easiest part, and you can easily score out of I would say 20, 18 and 19 marks, because these surgical skills are not like they are actual. They are just wanting, they are just requiring you to perform those steps which are required. 60% of this skills part is about your communication skills, which are you lacking. 60%. Only 40% depends upon your knowledge and other things. Okay, so perform it according to. So communications, for the surgical skills, you have to read Andrew Miller. Don't go for the Sala notes. Okay, you can read some questions from there, but the skills, how to perform, how to do the steps. Number one is Andrew Miller, and second, we will give you hands on for all these skills. These are like incision and drainage, how to pass the Foley's catheter, test tube insertion, this OT listing, all these things. So that will be hands on. So two things. Next is I'm coming to my slides again, that communication skills, clinical and technical skills, and professionalism. What is professionalism? When many of the candidates, they come and they share their result with me and say that we failed in professionalism. So what is professionalism actually? Professionalism is, see, you are taking the history for the patient who came to you through the ambulance, and you are not realizing this to the patient that you are brought by the ambulance. So your empathy, your counseling skills during the history taking, all these are parts of your professionalism. Similarly, if the patient during examination, for example, is having severe pain, and you are not realizing
You're proud of it. You're proud of it.
Sorry guys, I don't know who was it. Okay, so if the patient is saying, for the example, you are doing the examination and patient is saying I'm in pain, and you are not saying empathy and all these things, so you are lacking professionalism. So this is professionalism. Please, whenever the patient is there and you see that patient is brought by the ambulance, so you should be according to the scenario. This is known as professionalism. So listen actively, use your body language while you are performing your communication skills. We will teach you all these things. Don't worry about this problem. Speak very clearly to the patient. You should be confident. This is all about confidence. Okay. And for the anatomy, again, we have uploaded also the 3D videos, and please see those videos as well to maximize your knowledge for the anatomy and images, model, surface anatomy. There is no book who has given the surface anatomy. That is why I made special videos for surface anatomy, and I made special notes for the surface anatomy. Please go through those. These are uploaded in the WhatsApp. Okay. And then everywhere you have to be very professional. One more thing, I will give you a scenario for the professionalism just at the end. Okay. Then all about interpret clinical and lab data, and whatever they show you the labs in the critical skills part or in the examination part. If they show you some labs, some ABGs of the patients or other labs, go and you should interpret. They show you some X-ray, some ECG, you should know these things. Okay. Then there are procedure skills, suturing, cannulation, drain insertion, and you should know that what is the exact technique and how to perform it. And again, I would say 60% is your communication skills. Okay. So preparation, I would say that 3 months, more than enough. 3 months. If you are well dedicated and you are sparing about 5 to 6 hours a day, 3 months are more than enough. But if you are like 2 to 3 hours, then obviously 6 months. You need 6 months. Okay. And again, practice, practice, and practice. That is the key to pass this exam. And practice not only skills part, you have to practice knowledge part. So I would say again, take 1 to 2 minutes. Why Pakistani candidates are failing more in the knowledge part as compared to skills part? The reason is that because we are not practicing knowledge part. As I spoke earlier, that in the knowledge part you have to answer 18 questions, 20 questions in 9 minutes. So if you will not practice answering this question in 20 seconds, you will not be able to answer these questions in the exam. What you will do, you will reach 10, 12 questions, the bell will ring, and your exam will be finished. So please, please practice for the knowledge part. I have made short definitions, short and pinpoint definitions, rather than long definitions and rather than long explanations. So you should know those short definitions and to answer very important. It's not my exam, so it's your exam. So if you will not practice according to the exam requirements, obviously you will not be able to do. Form study group, please, at least um, 2 to 3, and not more than 3, obviously. If more than 3, you know what will happen. Only 2 to 3 people, small group, and then continue. One should be the examiner, other should be the candidate, and then perform your all history, all your knowledge parts and the skills part. Use mock exams, yes, and video feedback, obviously. One thing I am again angry with you guys, and that is, I frequently said that record your video either for the history, for the examination, whatsoever, send it to me, I will analyze. I or my team, one of the us, send it to me privately, we will analyze it, and we will let you know that where is the problem. And but no one cares. What's the problem? See, this is not my line. This is line from the Royal College. Poor communication and patient interaction. That's the first thing that happens when you are failing the exam. Poor communication. And second, again, inadequate practical experience. Third line, overthinking and missing obvious. If you are just see and go through the process, it is same process you are going through, for example, to see the patient, same things, nothing else. And you have to follow structured approach as taught by the Royal College. Okay, and then the final advice is treat every patient with respect, focus on safety and professionalism, don't dwell on bad station. Yes, if you have one bad station, for example, and I will give you my example. In I am not like here having gold medal in MRCS. So my call to consultant consultant station was completely destroyed. Like I finished it in 5 minutes, less than 5 minutes, because I could not read the file. Why? Because nobody taught me the way you are being taught. Nobody told me there will be a big file, and you have to read that in 9 minutes, and how the file will be, what will be in the file, what you have to read. So we did only ratify the scenarios and went into even we did not know what will be in the file. And there was a big file, about 20 pages. So I wasted my whole time of 9 minutes in reading just about the input and output of the patient. what is the what was the input, fluid input, and what was the urine output. So 9 minutes I wasted there, and I did not know anything about the patient. And after 3 minutes, the consultant said, "Okay, goodbye." Okay, so but I did not focus on that. I went on. I passed the exam with good marks. So if only one station is gone, nothing is there. There are 16 more stations to pass the exam. So don't worry about that. Second thing, again, coming to the professionalism. So professionalism is that you answer the one thing I told you about the communication. That is one of the part of the professionalism. Second is that, for example, the patient is asking you that this patient is having PR bleeding. So and he is having extensive PR bleeding. So which test you will do? And you saying that, okay, I will do the endoscopy, I will do the fecal colporotectin, and I will do CT scan, CT angiogram. You are not saying that I will, first of all, I will do the HB. I will see what is the HB of the patient. Similarly, if you are not, obviously you have to answer, you have to tell them about the fecal colporotectin, all these things, but you have to tell them, first I will go to the FBC, will see the HB of the patient, and manage the patient according to that. And then fecal colporotectin, I will go toward the diagnosis. So this is professionalism, that how you take the scenario. Is it an emergency scenario as it is outpatient scenario? So you have to, again the point will come on the first 1 minute. So that 1 minute is the key. You understand what I mean now? So guys, that is all from my side for today, that how to prepare it. Now again, how to prepare it, summarizing it, I will summarize it. So you have 3 months. So go through, I will upload the all the schedule today. So of those who have exam in June, I will upload for them as well. We will conduct the classes for them as well. And if we feel that there are enough candidates for this exam in June, we can conduct one hands-on session in Lahore. Probably we'll see that where most of the time, most candidates, if they are from one center, we can conduct in either city. Then I would say that, again, for the knowledge part, Sala notes, number one. Number two is McMinn Atlas, and then Sing notes. And if you have time, you can go through some other books. For the skills part, Bazid notes for the history and examination, and for the for the surgical skills, go through the Andrew Miller, and also with the hands-on sessions. So this is what you have to do, and then practice, practice, and practice. Please see, it's your exam. It's not any tutor's exam. You are all postgraduate. It's not any tutor's exam. Tutors are the mentors. They cannot practice on your behalf. So they can just tell you how to do it, how to do it. So if you are not practicing according to that, it's none of the mentors' fault. Either it is Salah, it is me, it is Mr. Nurez, it is someone else. It's not their fault if you are not practicing enough. So please practice it carefully. One more thing, you pass exam from, for example, you pass MRCS Part A from one college, MRCS Part B from other college. There is no difference at all. No difference at all. Okay, you will be given GMC registration according to your exam. If it is passed, you will be given that, because it is intercollegiate exam. Number two, is there any difference in the stations? No. This is intercollegiate exam. The paper that is distributed, the same stations everywhere. Same stations everywhere. Number two. Number three, Is there difference in the centers? Yes, there is difference in the centers. Which centers? In UK and Ireland, the non-English people, they have less chances to pass the exam. Reason is that because it is percentile exam. It is like a competition exam. So you have to compete here when you are in the UK and Ireland. You have to compete with UK and Irish people who are already being trained here. So you have to compete with them. One of the I would say that you have to compete with them. So that is why it is difficult. But if you are going in Pakistan exam, for example, there should not be any difference. Similarly, if you are in Gulf or Malaysia or all these centers, there should not be any difference. Recently, there is a difference seen in Karachi and other centers. Yes, it is seen. We are trying to probe out the reason. Either the reason is candidate or the center itself. So whatever the reason will come out, we will let you know. Then passing marks. What is the passing ratio? So we don't know actually exact passing ratio, but yes, there is an average knowledge part. Passing ratio, passing marks average is safe is about over 110 for the knowledge and around 120 for the skills part. That is the passing safe passing passing margin, I would say. What else? Yes, you have plenty of questions in the chat bar. I will go through one by one.
What is the average time for an orthopedic surgeon to prepare for the exam?
Thank you so much. So, doctor, it depends upon whatever you have, what time you have. If you are a consultant, I would say take 1 minute, 1 more month, because for the consultants to come back to this level, which is actually intermediate exam, they take time. So I would say take one more. If you can give 5 to 6 months, 6 hours every day, I would say take 4 months. Okay. Origin and insertion of all muscles is important. I would not say all muscles, every short muscle, but important muscles like bicep, tricep, this in every portion, like in the if you go to the leg, about the gluteus medius maximus. So important muscles, yes, this is important. The injury of which muscle is important, the origin session is also important. Sala notes, told you for what you have to do for anatomy. Dr. Hassan, he asked you about the link. It is in the group description. If you go to the MRCS Osce Pakistan 1 or 2 group, there is group description. Go there. There is Telegram group channel link. It is there. One more thing, guys. MRCS Osce Pakistan and MRCS Osce Pakistan 2, both are my groups. If you are added in one group, so sending request in the other group will not help you, because we will not add you in that group. Okay, we will not share anything extra in one group. Okay, so please avoid this waste your time and mine as well. Anatomy sessions, yes, I am going to record the anatomy sessions first. Yes, please, I will. Seeing notes, how important? So what is seeing notes? Actually, seeing notes is also almost same as Sala notes, but their way of question is different. Like their language of the question is different. So I would say that go through those at least one time. Okay. Anatomy videos. Okay, sure. I will share. Dr. Amir, I'm not respected. I'm not sir. I am simple Zulkarnain. Thank you so much for your comments. Um, I explained it between Pakistan and UK. Bazid notes for skills. It is Bazid notes. Doctor, your name is difficult. I don't want to pronounce it wrong way. Dr. Zakir, I will upload the lectures obviously in the classroom. Okay, good question, Dr. Raja Shoaib. Very good question. That should we focus towards the patient in those 6 minutes? You are not supposed to focus towards the examiner in those 6 minutes. My history lecture is uploaded on the YouTube channel. Please watch that one carefully. Note down the points. If you have still the question, come back to me. Bazir notes, Dr. Stecken, it is in the on the Telegram channel. You can send the request and join that. Upcoming hands-on session, I will analyze. I conducted a poll few days ago in the groups. I am extremely thankful to all of you that you voted there with your extreme honesty, and then I will analyze that how many candidates are there for June, and then we will conduct one session for the June if there are enough candidates. We will conduct, and then obviously for August, September, and October diet, we will conduct on all these 3 cities. Actors, depends upon. In Pakistan, the actors don't know how to speak English, so they cannot distract you or tease you except if they don't know what to do. So that is the scenario. But in other countries, I don't think so. 1 or 2 stations might be, but not frequently. Any other question, please? Dr. Zakir, I know you are from Islamabad. Thank you so much. I will see that how many candidates from June for June, and I will try wherever maximum. But see, if we are going for June, Mr. Nurez will be coming from Faisalabad. Mr. Waji, he will be coming from Lahore. So they have to travel as well. I think 3 days you can travel to Lahore. Thank you so much. But I don't know. Frankly honestly speaking, I don't know where are more candidates from. So I don't know it is going to Islamabad or Lahore. I don't know it. I did not analyze that yet. So, Dr. Sadaf, very good question. 4 days before exam in Lahore. Oh my God, you want to take hands-on session 4 days before the exam? I am already late. We are already late. Hands-on session must be at least 1 month before the exam. At least 1 month. You are not going to revise your all the skills 4 days before the exam. You are not going to practice these 4 days. So it has to be at least 4 weeks before the exam, so that you can practice it in the next 4 months, in 4 weeks. So that's what I was actually advocating for the last couple of years. How we can summarize? Please, Dr. Raja, see my history lecture on the, YouTube in the 30 seconds. How to summarize the history in 30 seconds. So only do the positive things. For example, patient comes to me with pain, abdomen, bleeding, PR bleeding, and brought by the ambulance. 30 years old, John. So he is a chronic smoker and alcoholic as well. Has family history of Crohn disease, and now the patient is in shock. So I would say that Mr. John, 30 years old, male, brought in by ambulance in the emergency services today with the history of bleeding per rectum, severe associated with the nausea, vomiting, abdominal pain, having no temperature, no shivering and chills, has very strong family history of inflammatory bowel disease, but no cancer. Patient is smoker and alcoholic, and the blood is bright red mixed with the stools, and that's all. So that's a whole. Oh, for hands-on, Dr. Hasib, we never ignored Peshawar. My first session was in Islamabad. The second one was in Peshawar. So in 2023. So last time we also did the session in Peshawar as well. This is the only time we did Islamabad session in Islamabad because there were more candidates from Islamabad as compared to Peshawar. So we never ignored that. We had already 2 sessions in Peshawar. I love Peshawar. I love their hospitality, and it's never ignored. Okay. Okay, sure. I will upload lectures on the YouTube about the not sure. In the examination, yes, you need to ask the relevant question you can ask. Hands-on for October attempt, obviously will be there, 100%. Okay, any other question if you want to ask, please. If no question at the moment, we can call off the session, and then you can send me the message personally. And please request, if you have time, do comment in the group about the session. Was it useful or not? Okay, whatever your comment is, I don't mind. Okay, thank you so much. Please ask me the question. Okay. Okay, yes, Dr. Nusrat, they can ask course, but not frequently. Believe me, not frequently. Usually they don't ask for the course, but they can. Obviously they can, but not frequently. I have not heard about the nerve course question. Okay, guys, thank you so much. And please ask me the questions personally if you have. And please comment in the group about the session, whatever your experience was. Thank you so much.